Hello, my name is Sarah. I'm a PA student working here at the clinic today. I see you have some questions about fertility treatments, is that correct? Alright, you and your partner have been trying for a year and have not had the result that you guys have wanted. I'm very sorry. I understand it can be very frustrating to not have a pregnancy after trying for so long. But I'm here to help. I'm here to give you some information, answer any kind of questions that you may have, and guide you in the right direction if I don't have any of the answers that you might have some questions to. So some of the non-medicinal or pharmacological ways that people can try is eating healthier, like reducing your fat intake, reducing fast foods, eating healthier foods like veggies, beans, and reducing alcohol and caffeine intake, reducing tobacco intake, and leading a more active, healthier life just to help the body be at its most optimal health. Another non-pharmacological option can be reducing stress. A lot of stress can interfere with your hormones, which can interfere with getting pregnant appropriately. So a lot of people like to go to counseling or have group therapies that can help with reducing stress, and that can be an option. Some pharmacological options that people use is a medication called Clomid. It helps with ovulating for people who don't regularly ovulate every month. So this is a medication that you take for 5 days, and it will help ovulate one of your eggs. And a side effect while using this medication can be headaches, mood swings, fatigue. So just look out for those things. And if you have a pre-existing liver disease, then this probably would not be a good medication to use. Another medication to use would be a medication called letrozole. Letrozole is a pill that is used for people who have polycystic ovarian syndrome, where a lot of your ovaries contain little cysts that don't really contain any kind of eggs, so that can interfere with ovulation. Letrozole helps with people who have PCOS ovulate, and some of the side effects could again be fatigue, headache, dizziness, mood swings, things like that. So during all these medications, and even without using medications, we would want to use an app or a calendar to keep track of when you have your period, the most likely time periods where you would be ovulating, and the most optimal time to have intercourse so that you could potentially get pregnant. It just helps with that process. And as far as successful rates, it just depends on a lot of factors. It can, on your hormones, on your egg qualities, on your age, on quality of your partner's sperm. It could be genetics. A lot of things can play into the successfulness of pregnancy. So with these initial treatment options, we can try those, see how those goes. If at that point these options don't help, then I can always refer you to a specialist. These specialists will do more testing, more medication options, more knowledge of the process, maybe also have more procedures that could be very helpful in determining and identifying, causes of what could be not resulting in pregnancy. So that's always an option as well. Although with any kind of medical medications, procedures, sometimes insurance doesn't cover it. It can be very expensive. It can be very emotionally draining. So that's just some things to think about as well on your journey. So if you don't have any questions, then I wish you well. I'm always here for any additional questions or any support in any way that I can. Okay, thank you.